Serous otitis media. What is serous otitis media? It is otherwise known as otitis media with effusion. Okay, so let's look what is actually happening here. Okay, first this is the external ear and this is the auditory canal and the tympanic membrane. Inside is the middle ear cavity and is connected to the nasopharynx via the eustachian tube. Okay, so whenever there is any issues happening in the nasopharynx, this will lead to the blockage of eustachian tube and this will lead to effusion in the middle ear. First one is there is hypertrophy of the adenoid. That is, adenoid is centrally located, right? So whenever there is hypertrophy of adenoid, it will block the eustachian tube. And whenever it is a central structure, so the blockage will be bilateral, right? So there can be bilateral blockage. So first reason is due to the hypertrophy of adenoid, and it's mostly seen in children, right? In adult, this adenoid become atrophied. Okay, then what is the cause in adult? In adult, it is due to nasopharyngeal carcinoma. But nasopharyngeal carcinoma is only unilateral, right? Maybe it's unilateral. So the cause will be nasopharyngeal carcinoma. Okay, then what is actually happening? In acute otitis media, what is actually happening is due to a nasopharyngeal infection like pharyngitis, etc., can lead to infection of the middle ear. Okay, so there will be infective features in the tympanic membrane. The tympanic membrane will be having hyperemia, etc. But it may bulge out. But what is actually happening here? As the eustachian tube get blocked due to this growth of hypertrophy of adenoid or nasopharyngeal carcinoma, there will be a negative pressure in the middle ear cavity. This will lead to exudation of contents from the blood vessels nearby. Okay, so this will increases the fluid content in the middle ear cavity. Okay, so whenever we shine a light to see the tympanic membrane, it will become dull on vision and there will be fluid present behind the tympanic membrane. Okay, so next one is the clinical feature. The clinical features include this will be bilateral. As I already wrote, this is due to hypertrophy of adenoid. So it will be bilateral. Is there be any pain? No, because when the pain occurs only when there is increase in pressure in the middle ear. As we all know, the pressure in the middle ear is already negative, so there will not be any pain. Okay, then what next? It will be fluctuant. That is, hypertrophy adenoid occur when there is allergic infection and all. It will not be any constant phenomena, right? It will be fluctuant. That is having seasonal variation. So it will occur when there is only seasonal variation and having allergies. Okay, there will be speech difficulty. Why it is occurring? Because the child can speak out only when he understands what the people say, right? So in the middle ear, the important structures will help in conduction, stapes, malleus, ingus and all. So due to fluid fill like effusion in the middle ear, this will not work properly and can lead to conductive deafness. Okay, on examination, what all can be seen? There will be dull eustachian tympanic membrane and there will be grade 1 retracted tympanic membrane. Okay, this considers this as tympanic membrane. These are the malleolar folds and these is the lateral process. This is the handle of malleolus and this will be the cone of light. The things that can be seen is, one is the retraction. Next one is the cone of light will be distorted. Okay, the fold will have a sickling shape. There will be prominence in the lateral process. There will be shortening of the handle of malleolus. Okay, these are the things that can be seen. As there is fluid fill behind, there will be bubbles. Okay, then air fluid levels can be seen. Next thing is due to the collection of fluid and sometimes the cholesterol get accumulated and it will lead to cholesterol granuloma formation and will appear like a bluish color. Okay, then after sometimes when the fluid gets collected for a long, this fluid become thick like a glue. So it can be also known as glue ear due to chronic infection and the thickening. Okay. Then regarding the examination, what about 24 test? 24 tests will help to identify the conductive deafness, right? Okay, conductive deafness. So what about Rene's test? Rene's will be negative because of conductive deafness. Weber's, what happens to Weber's? The affected side will have, it will be localized to the affected side. So Weber's on the same side. Scherbach's test will be lengthened, and on tympanogrammic study there will be a B-type curve. Okay. Then regarding the management, what is the first management that can be given? Medical management. When only the medical management fail for around 3 months, then we start for surgical treatment. Then we start for surgery. Medical management, what all can be given? Nasal decongestion can be given. Steroidal nasal spray can be given for reduce. For allergic causes, we can give anti-allergics. When all these fail, we start surgical treatment. Like first, what have to do? All these happening because of adenoid. So we have to do adenoidectomy plus the tympanic membrane. Behind the tympanic membrane, there is secretions, right? We have to remove that. So we have to do myringotomy plus grommets. Grommets are things like these will provide a ventilation. That is, we consider this as a tympanic membrane and we put a radial incision in the anterior inferior side because it is a safer side in order to prevent the injury to the vital elements like middle ear structures like malleus, incus, etc. So we put a radial incision and we put this inside. Okay, this in, and it will provide a ventilation and it will help in the elimination of the fluid and all. If we don't provide the grommet, what will happen? If we only do myringotomy or adenoidectomy, what will happen? The eustachian tube itself is blocking. So there will not be any ventilation. So we put a short-term grommet, and the grommet is put for 6 months, and it usually when there is a unresolved acute otitis media. Unresolved acute otitis media can also lead to serous otitis media. Thank you.